This is Switzer Network News. We usually think of hospitals as a beacon of health, but they can have an impact on workers and patients.
So looking broadly at a hospital to try to make it both more healthy and more sustainable, there are a lot of issues involved. Energy, water, the materials that go into the building, the amount of waste that may be generated during construction. Is the building flexible enough so that it can last a long time and we don't have to waste more resources building a new one? And then, of course, very important is both the health and general well-being of the people inside the building. People occupying a hospital have fairly different needs. The patients, obviously, are far more sensitive than the general population, especially depending on the type of issue that has brought them to the hospital. The staff, as well, are under a tremendous amount of stress and pressure. It's a very challenging work environment. Often shifts are very long and overnight, which has its own health implications, unfortunately. So we have to look very closely at the kinds of people who are occupying these spaces and address that differently than you might for, say, a standard office building or a house. There is a fair amount of growing research that suggests that we have very significant positive impacts from views to the outside, both in terms of the healing process and also in terms of stress reduction. But those people without windows, oftentimes in a hospital environment, it would be a nurse, aren't getting the kind of relief that their eyes need and their brains need when they have the opportunity to look outside. Air is also very important. And there are really a couple of issues surrounding air. One is the quality of air, and one is the quantity of air. They are related. So if you move a lot of air through a space, you're more likely to remove pathogens more quickly or other things more quickly. They don't have the opportunity to build up in the air. And so hospitals usually have a lot of air moving through them. That's the biggest reason for all the energy that we use to run hospitals, is all that air that we need. Quality is important on another level in that we need to filter the air as it comes in from the outside, or if we have natural ventilation, then we want to make sure that there's not a ton of pollution immediately outside of the window. The end goal is to make the buildings far healthier, both from an environmental and a human health standpoint. We have in the design industry what we call big, hairy, audacious goals. And so my big, hairy, audacious goal would be for all hospitals or all buildings in general to be net zero energy use so that they generate as much energy as they need to consume, net zero water use, materials that are completely devoid of any kind of toxic substance that might cause harm either to people or the environment, and similar types of measures that provide people with absolutely the healthiest possible space that they can inhabit.
Mara Baum is one of dozens of Switzer Fellows doing innovative and inspiring work. To learn more, visit switzernetwork.org and then click on the News tab. I'm Jerry Kay.